And for the final speech in the open debate, Lloyd Melville.
Thank you, Deputy Presiding Officer, and let me start by welcoming the Cabinet Secretary's statement and congratulating her, Marie Todd and Alison Thewlis on their new roles. Access to the NHS came up time and again on the doorsteps during the election campaign. Now, people are rightly proud of the NHS and they value it deeply, but when they need care, they want it quickly, locally and without having to fight for an appointment. So that is the test that we must meet. But the future of the NHS will not be secured by hospitals alone. Hospitals matter, waiting times matter, so do operations, diagnostics and emergency care, and I want to thank all of the staff who look after all of us. But as others have touched on, if the NHS reaches people only when illness has become crisis, then it has reached them too late. And that is why prevention must be at the centre of our healthcare strategy, and I welcome the comments that have been made on that. Not just in theory, not just somewhere down the line, but as the practical work of keeping people well, catching illness earlier and protecting the services people rely on. That means stronger general practice, because the first door into the NHS must be easier to reach. It means hospital at home, because for some patients the right care is not in a ward. It means social care that helps people leave hospital when they are ready. And it means GP walk-in centres, because same-day help can stop pressure building into an emergency. And, Presiding Officer, I welcome this Government's manifesto commitment to deliver a walk-in GP centre in Angus. For the people I represent, that means another route to care, less pressure on existing services and support before a problem escalates. Our aim should be simple: the right care in the right place at the right time. And I know from my own experience in Monifieth how much pharmacies already contribute to primary care in the community. When pharmacies are fully used, people can get care quicker, closer to home, and often without needing a GP appointment at all. That is not a second-best service. It is the NHS using the skills already present in our communities. Now, Presiding Officer, there are not many moments in public health when a country can say we have the tools to end transmission of a virus. But on HIV, Scotland can say that. Early testing, treatment and PrEP give us a clear route to zero new HIV transmissions. And together, this Parliament could be the one that delivers it. What a legacy that would be. Earlier help matters just as much when someone is struggling with their mental health, as many others have touched on. In my Angus South constituency, the Beacon in Arbroath is already showing what accessible walk-in support for young people can look like. And my colleague Heather Anderson has set out that just over the border in Dundee, Hope Point is delivering vital support to anyone who needs it 24 hours a day. And I have seen firsthand the difference that those staff can make, and I want to thank them for it. When someone is in mental health crisis, they need care, not a system that defaults to a police car or a hospital admission. And as the Cabinet Secretary has said, the introduction of mental health triage cars in Fife, Glasgow, Dundee and Inverness have shown a new approach can work. And our commitment to roll them out across Scotland is exactly the kind of shift we need. Presiding Officer, that same principle should guide our longer-term health strategy. Help earlier, closer to home, before problems become emergencies. But prevention cannot stop at the door of the health service. If poverty makes people ill, then tackling poverty is health policy. If cold homes make people ill, then warm homes are health policy. If poor transport stops someone getting to an appointment, then transport is health policy too. The NHS treats illness, yes, but a healthy society prevents it. That means making sure our bairns do not go hungry, homes are warm, dry and safe, and folk can afford food on the table and a roof over their heads. That is health policy too. None of this removes the need to treat people who are waiting now. People need appointments, operations and emergency care. They need staff with time, buildings that are fit for purpose and systems that help rather than hinder. But if we only respond once people have reached crisis, we will always be asking the NHS to do too much, too late. The serious answer is to move care earlier, support earlier and investment earlier. Not away from the NHS, but into the services and policies that stop people reaching crisis in the first place. That is how together we will renew the promise of the NHS. A public service free at the point of need, strong enough to treat people when they are sick, and bold enough to keep them well throughout their lives. Presiding Officer.